Be talking about cancer because February 4 is World Cancer Day. Cancer conversation on Nigeria Info will be very constant today. So we have other cancer conversations on other shows on Nigeria Info all through the day because it is World Cancer Day. So we're starting with that right now on the show. Many thanks to you. You can join the conversation on Facebook and YouTube. We're there also on Twitter at Nigeria Info FM on Twitter. Tweet me, let me know if you got questions around cancer. I have a very able mind in the studio, and I will try and give you answers to your questions on cancer this morning. You're welcome to join the conversation. So let's start. I have Dr. Modupe Elebute in the studio. She's the CEO and co-founder of Marcel Ruth Cancer Center and a Specialist Hospital. Dr. Modupe, good morning to you, ma'am.
Good morning, Sheriff. Thank you very much for having me on your program.
It's good to have you here. How was your night?
Very good, actually. It's been a busy few weeks where we've just started our open the doors to our hospital and specialist centers. So there's been a lot of work, a lot of moving of equipment.
I know.
A lot of getting the team together.
Right.
And in particular, that's actually quite topical for us. This starting that we're getting open at this particular time when Cancer Day, and actually, indeed, it's Cancer Month, which kicks off today. Right. And we've spent most of our time making sure that we're in a position to start receiving patients to look after them with to an excellent standard.
Right.
And this month, each member of the team is focused on the mantra of I am and I will. So I am Dr. Modupe Elebute. I'm a consultant hematologist by specialism. And as you said, CEO and founder of Marcel Ruth Cancer Center and Specialist Hospital. And I will ensure that our hospital provides the best care to every single patient that walks in through our door, that we look after them not just in terms of diagnosing, which is a big issue in this country. We'll talk about that later.
We will.
And providing every form of treatment possible all on one site, where we pride ourselves in having developed a comprehensive one-stop shop. And we're also focusing and launching a screening program.
What does that mean?
So the issue with cancers in this part of the world and in most developing countries is that the majority of patients with cancer present quite late when the cancer is already spread. And with the best will in the world and with the best treatments, you're sort of chasing what is already a big problem. And the chances of getting that patient cured are very small. But with cancer screening programs and early detection, there's research that shows that we're now able to cure the majority of patients if they present early. So our focus now is to really do our best to change the narrative in Nigeria and most of the developing world to educate people that yes, cancer is going to occur, like malaria will, like COVID will. But what is important is picking it up early, accessing treatment quickly, and in that setting, we will have a fighting chance of actually curing the majority of patients that we see, which will be fantastic.
We'll come to the issue of early detection and diagnosis much later on. But for people listening to us, especially the lady who is just in a shop opening up right now, how would you, in layman's language, explain to her what cancer is? And then we'll move on to what breast cancer is.
So, cancer, by definition, is a collection of abnormal cells. The body, for some reason, switches from producing normal cells in a particular area of the body, be it breast or lung or prostate, and instead of producing those cells in the normal way, something happens that makes those cells become abnormal. And when you look at them down the microscope, there are different ways that they become abnormal, which becomes a bit more technical. But essentially, that's what cancer is. It's a group of cells that are no longer being produced in the normal way, the abnormal cells. And then the way that some of them secrete proteins that then destroy the organ that they're in. And certainly some of them travel within the bloodstream to other parts of the body and then cause more damage. And then when they spread, so when they're in that organ where they started off from and they remain there, that's what we call early stage cancer. And when they spread to a distant area, then we say that's metastatic cancer.
So this
cause them to spread or are related to the why they spread are if the person hasn't sought medical care and gotten that local problem sorted out. So there's time for the cells to spread. There are other things that make it more likely that the cancer may spread. The type of cancer, the type of cells, because some cancers are just more aggressive than others. And also, particularly if you have a family history of that particular cancer, then you're more likely to have a more aggressive form, which again is more likely to spread. Not always if it's picked up early, but if it's not, then the family history, the delay in getting treatment, and the type of cancer that it is are the reasons why cancers could spread.
You know what? If you got questions for my guest this morning, feel free. Drop your questions for us on Twitter at NigeriaInfoFM with the hashtag NigeriaInfoMCF. I have a feeling that you've got a lot of questions on your mind, so feel free. Drop your questions and we'll come to them. If you leave everything to me, I have plenty of questions, so we will not get your own. But once you drop yours, I can come, take them, then I have my own for doctor, and then we'll come to yours as well. You can call in as well. We'll take your phone calls, take your questions, or just drop it on Facebook, on YouTube, on Twitter. Even WhatsApp is there for you to drop your questions. Doctor, you said something earlier that, cancer has cells developing abnormally. What causes that abnormal cell growth?
Okay, so in quite a number of cases, we don't really know. Historically, cancers were caused by people who were exposed to large amounts of radiation. So if you remember your history, the Hiroshima bomb, for example, a drug can cause cancer, exposure, people who work in that industry. And like I said, family history means there's some kind of genetic issue that somebody has that carried in that predisposed to cancer, breast cancer. We see the very celebrated story in Jolie, who's breast cancer, and she chose to have a very, very brave move, really, to combat testimony. Yes, in a way, quite brave. But in other children who knows that you have this very history, and also these days we have special tests to do to look at what is gene being the cancer in the family. And I suspect that she had done, really shown that in her it was positive and she will not get cancer down. Of course, I think, so I suppose I can start as a very young child. I think might as well, as much as I can live a full life to be there for my family.
Let's talk about early diagnosis. How early can this be? What in those?
So early is the cells being unusually what they begin from lump, let's put that, right? So breast cancer, what we're talking about morning. And that's a sample of form. And with woman case to examine herself on a regular basis, a particular way to see her breast, whether they're new, whether they're down to her nipple, whether she's got this and all those things would trigger alarm.
Can you go signs and
so what is it? Was you read your breast examination of phase, so you pass period, because the breast ended then, and you by looking at the mirror to see whether the thing looks abnormal, and you and go through the different areas of your feeling to see feel up
and sweat mass that is on the.
It might not have all lumps are. Then there's a problem. It's your problem. The breast itself is a granular tissue, so you have lumps that are not cancer. So the breast in the woman is not unusual and the period. So, what is important is regularly we tell whether the lump getting bigger than one lump, and whether change in how it feels. In particular, if there is other see around the nipple,
Right.
whether it's attached to the skin stretches more, and definitely if there's just one that's had a baby using breast milk.
Right.
There
right.
are cats on websites, Google. There are YouTube videos that how to examine yourself.
Right.
On is
Right.
very much encourage anyone who's listening this morning to take this to look at those examples.
Right.
I also encourage really of how you examine and examine the toilet. Ladies in organizations, so
Right.
by doing you could be saving life really, because if the woman sees I'm going to examine myself and picks this lump. And that could be saving a life. It's not every lump that is cancer, and so it's not, when you find a lump, you don't need to panic. What is it? Not ignoring it. That is important, and this is why I see in this environment that people see something has gone wrong, and they watch it as it continues to get big. They maybe discuss it with their friends, they discuss it with their family, they discuss it at church. And so on. But the last thing they do is actually go and see a doctor. When that you should be doing. And
Ask you like what is step to take once you discover you've got lump? Once you find the lump there, step what I think is to do.
I mean, sometimes it can watch it a while.
Okay.
Like men, we do have lumps, particularly if you're eating and so on. But it's something that is getting bigger. You should definitely go and see a doctor. And then what we normally initially is a very old, which is this way. It doesn't involve any looking at what the lumps look like, where they are, why, and most of them, the emotion for and of them. And it's not big about women of age above the age of 50 mammograms.
Yes. I mean, how old is you?
Well, the first one is not country. They may do this and they are not obviously going now some drugs that have been developed.
Pattern we've started in diagnosed prostitution. Before that, let me see. I can send one call to and they forward from wow. I think some caller. How do we do? 6 9 and you can tell because I want to bring up can I with favorite is 29 do what you're doing lives this morning and we talk cancer but here
Spark up your creativity better than Google
on that letter later for the service we break out here runs live and Twitter no just end but we have time all forms are open round for you it's ambitious here on Nigeria back to the very on there please thank you for that my mouth this sentence is
but yes, there's a lot in that get access to treatment, full stop. Obviously cancer, because this is Cancer Day, but I think in general the big issue people they should be done in the public sector, that's for sure. And obviously, yes, the message has to be clear to government and to everybody in the sector who are developing policies around this, who are implementing policies around access to care for cancer patients. It's needed. And I say, even in my clinic, it's very, very difficult watching young men who have young families who are to access the care that they need. And our issues are not even just about treatment. Even diagnostic tests are they're expensive. Get to treatment. The drugs are expensive. Although cancer treatment is expensive. The biggest issue for us is that therapy. Supposed to have in population statistics a therapy machine per 100,000 of a population. That's the international guide. Yeah. In Nigeria, we have 200 million people. We have at the moment, which at least 1,000 machines. We now have 5 functional machines.
Excuse me.
That is what's up today.
5 radiotherapy machines.
Yes, for the whole of Nigeria. That is what we have that's functioning today.
God name, what
yes,
do?
I mean we're bringing one into Marcel Ruth Cancer Center, but we're a private organization. We're bringing one in to keep the gap. But apart from the equipment, the other big issue, Mr. Tunde, is the skills. Okay, so I've just returned from working in the UK for over 30 years, and what I will tell you is the skills to manage patients in the right way is really lacking. And every day, doctor that we hire is going to leave the country to go to Canada, to the UK, to find their post-study training. We have to also, by changing this whole issue of everybody leaving.
Wanting to leave.
Yes, because we don't have the skills and the equipment. And I think really, the number of NGOs, actually, there is this, Mr. Sunday, is not all doom and gloom. There are a number of non-governmental organizations run by amazing individuals.
Right.
We have already registered a foundation, so we're going to do our best to help well.
Brilliant.
But, honestly, share.
We're going to jump this call. Let's see who we've got here. Good morning.
Yeah, good morning. My name is Taiwo.
Welcome, Taiwo.
Yeah, thank you very much.
Tell me, Mbele.
Okay, concern talking about boss how to that, and that'll be like cancer. Maybe by say someone have a cancer of the possible treatment for cancer of the liver.
The possible treatment for cancer of the liver.
Yeah.
Okay.
What causes it?
What causes?
What
Okay.
is the treatment?
Okay.
Well.
All right.
Yeah.
All right.
Good morning. Good morning, Mr. Taiwo. The liver isn't very common. I will take too many comments on that. Typically, usually, if somebody has cancer in the liver, it could be that it's cancer somewhere else.
Okay.
So that's one thing to be of. But if you're talking about primary liver cancer, things that cause primary liver cancers are, for example, people who have alcohol over a long period of time, who do what we call liver cirrhosis, so they're working so well, and that is to liver cancer over a period of time. Some viruses, like hepatitis viruses in the body, if they've been in the body for a long time, that can produce liver cancer. But liver cancer is not that primary liver cancer is common. What usually tends to happen, especially in this environment, is the spread from somewhere else. Okay. The commonest cancer are breast in women, prostate and rectal cancers are common, cervical common, lung cancer not as much, and then lymphoma is common. So primary liver cancer is not that common. Okay. So I would be careful to make sure that whoever has been given a diagnosis by a good cancer doctor and that they're ensured it's not from somewhere else. I hope that answers your question.
All right. Let's take another call. Nigeria, I think that's that. Nigeria, to
Yeah, good morning, Sharif.
Good morning.
Good morning to your guest.
Good morning.
You're welcome.
Doctor, honestly, I am glad to hear you say we have up to 5. As of 10 years ago, we had only 3, to the best of my knowledge. And of those 3, I think got spoiled or set up there, and the doctor friend. That machine we had 10 years ago was 3. You have it now. That's an improvement.
Okay.
The shame on this country.
Thank you, Chikuka. Nigeria, you're going to.
Hello, good morning.
Good morning to you.
I want to about breast cancer.
Okay.
This is a Ogun State.
Good day.
I have a sister. She's so young. I did your friends now. So she's having cancer since about 3 years ago, knowing to us that this is cancer that she's suffering from. And I took her to in Ogun State.
Okay.
Yeah. And it thereby some they diagnosed breast cancer, and we were about to go and started treating this thing. But what doctor just said this morning made me scared. And about the money we are going to spend. Even as I was talking to you, my head is not even in that thing. That if this is what we are going to face. So I just want to know, because the kind of they say that we should go into that 50,000 to us that we should also administer that one.
Wait, hold on. The treatment they've told you that your sister, do you have a name for it?
They just give us.
Did they tell you the she has? You told?
Yes. Breast breast cancer, and she's been carrying it for long. So
you said about 3 years.
3 years, not knowing what is happening.
Okay.
The money to be spent that side of is like difficult. But he explained to us that the treatment is not that it's going to cure the cancer, but for time the in one place. But What if we don't have such amount, close to 1 million, to do operation? We still have an opportunity. Maybe we can be managing. I just want to know.
All right, thank you.
So good morning, and thanks for sharing your coffee, which is a very brave thing to do. What I want is, yes, this is a difficult story for your family. The fact that your sister has already been diagnosed, I can't say it loudly. She needs treatment quickly. It's cancer spreads to the parts of her body, and they need to actually treat it and cure it. It becomes very small. What I would like to encourage you to do, and I hear an understanding, is for you to see if there's some NGOs where you can do and who may be able to offer help in setting to provide the treatment at a lower cost, or sometimes even, I'm sure that if you do a Google search or ask even doctors to go to some of these organizations. There are core organizations now over the country, across the country. The pharmaceutical are doing they can to use drugs to people who and there is hope. You have to try and find where you can get the help from.
Okay, I have a question here on WhatsApp. This person says, the question is for the doc, obviously. He said, I assume it's for breast cancer. What do you do for colon cancer, colonoscopy? Would it be a colonoscopy every 18? Is the history of it?
For colon cancer, the recommendations are that if you are above the age of 40, they think about screen. Certainly with a family history, then yes, you should be having a colonoscopy advice from a doctor, advice from a specialist. But yes, if there's a family history of colon cancer, then you should not ignore the fact that you should possibly get a colonoscopy every year.
All right. Cynthia is joining us on Majawa Estate. Cynthia, good morning to you.
Hello, good morning.
How are you?
I am fine, thank you. Hello to your guests.
Good morning, Cynthia.
Good morning. I'm only thinking that if the cancer management or managing those doctors managing cancer patients can come up and probably write something or go to the assembly to tell them every year from the health budget that they should buy one machine or two. Because it cannot be up to 400 million that they want to now go and do something else. If they can just buy two, because these are things, if the money is budgeted for the health system, these are things that we can see. You see those doing dialysis, go to some place, you queue up. How much are these things, please? They should try and make it open, right openly. People, these are the things we should occupy the National Assemblies for. Not so, well, let's do it so that, especially the poor, the rich will travel out, go to India. Whether it's the cow one they put for them or not, but they will go out and have a respite. But the poor will keep dying. Please, let's do something. Let it be physically known that every year we have 2 or 3. We can afford it from the monies that they are keeping out. Good morning.
Cynthia, very valid contribution. Thank you so much for chipping that in. Good morning to you.
Good morning, Cherry.
Morning to you.
And good morning to your guest.
Good morning.
Yes, my name is Abednego.
Welcome.
Thank you. So now, here's my question. First, I would like to know, is breast cancer only is it exclusive to women alone? Then second, Sheriff, if I remember, there was some either 8, 7, 9 years ago when a particular advert used to run across radio stations on, I can't remember the name of the organization, on whether donating 100 naira to kick off a cancer center or something. I just can't remember how that stuff was supposed to be. But I would like to know what happened. Did the plan finally happen or did it fell through?
Since we don't even know the name of the organization you're talking about, it's very hard to say that. But Doc, let's talk about whether it's exclusive breast cancer to females only.
I mean, that's an excellent question. And the answer is no. And in fact, recently I have treated a gentleman with my colleagues who had breast cancer. So the answer is no. Yes, it's much more common in women, but breast cancer does occur in men. It's rare, but it does occur. And so the same... what I was talking about apply. So if a man sees a lump in the breast that wasn't there before, they should keep an eye on it for a short period of time. And if it gets bigger or painful, or there is some discoloration or discharge from the nipple, then please seek medical help. because it is possible in men too. Excellent question. Thank you.
Kenny is here from VI. He sent a message on WhatsApp in, and he says, I have a question for the doc. I have a sister-in-law who is 19, but has been seeing a small lump on one of the breasts for a few years now. Sometimes the lump disappears. At other times, she sees it. Please, what could the doctor advise?
So, in a 19-year-old, it's much likely that this is benign. So, particularly in adolescence, periods, hormonal changes, lumps in breasts are absolutely normal.
Okay.
And that's what I was saying earlier. So the fact that you find a lump in your breast doesn't mean you should, get really anxious or get really worried. The fact that you've said that lump has been there on and off for a long period of time without wanting to obviously make a diagnosis on a patient I haven't actually seen,
right,
again, is much likely that this is not cancer. This is just a normal, we call them fibroadenomas, benign lump in a young woman. But if she's worried, if you're worried and she's worried, the best thing is to go see a doctor. At the least, just have an ultrasound scan, and the ultrasound scan will, make the diagnosis and allay her fears.
All right. We're going to squeeze in one more call, then we close the show. Nigeria Info, good morning to you.
Hello, good morning.
Good morning to you.
Okay. This is Linda.
Linda. Okay. You're welcome, Linda. Please, you have 60 seconds.
All right. Okay. Thank you, doctor. And this is quite insightful. This is a killer in Nigeria, and one or two families. In fact, I think almost every family now has a case of one cancer patient or the other. Now, my question is this. Some time ago, my daughter's school came up with a vaccination for cervical cancer. How proper?
The global burden of cancer is on the upward trend. In the year 2020, 19.3 million new cases and 10 million cancer deaths were reported. Though there are incomplete data collection in Africa, a World Health Organization report in 2020 says that over 700,000 new cases of cancer are being reported annually, with evidence suggesting that these were just tip of the iceberg. Diagnosing and management of cancer in Nigeria and majority of other African countries are also very challenging due to inadequate resources, lack of manpower, equipment and skills required. Unlike developed countries where there are more resources to combat cancer, the mortality of cancer in Nigeria is very high, and treatment modalities that can improve the chances of survival of people with cancer is grossly lacking. The theme of this year 2021 Cancer Day says, I am and I will. This is a reflection of the collective actions necessary to combat cancer. We all have a role to play. Individually, we need to identify the modifiable risk factors for cancer and avoid them. This can be achieved by healthy eating, exercise regularly, stop alcohol intake, avoid tobacco smoking, and shun self-medication. Majority of cancers, when detected early, could be managed better, and sometimes a cure might be possible. For example, regular breast examination for females could detect breast lump earlier. Some of these may be cancerous, and if removed on time, could prevent its spread. Mammography has been recommended for women aged 40 above for early detection and management of breast cancer. Other health checks like screening for hepatitis can identify diseases which might affect health negatively or lead to cancer. WellMed Healthcare Limited is a technology and quality-driven health facility.
Are you a salary earner and experiencing salary delays? In need of school fees, loan, or house rent? Does your business need expansion and you've got no money? Do you need a car or equipment for personal or business use? Worry no more. With Creditville Auto Lease and flexible loan products, you are just a call away from achieving your financial goal. Simply dial 0805 510 0010. You can also send us an email via info@creditville.ng or log on to www.creditville.ng. Creditville, financing you for a good life.
99.3 Nigeria Info. We are into the Just a Minute time right now, sponsored by Creditville. Let's play. Let's see if someone will stand a chance. By the way, apologies to Linda. Linda, I didn't see that coming as well. It wasn't supposed to be there at all. But hey, apologies. We have other conversations around cancer all day here on Nigeria Info. Let's give somebody 10,000 naira, shall we? 0700 993 993 993. Good morning to you.
Good morning.
Yes, what's your name, please?
Hamzat Babatunde.
Babatunde what?
Hamzat.
Okay, Babatunde Hamzat.
Yes, sir.
Okay, you want to play just a minute?
I want to try.
Okay, let's play.
Yes, sir.
Okay. Okay, Babatunde Hamzat, are you ready for just a minute?
Yes, I am.
Okay, here we go.
This is Just a Minute.
Your first question is, name 3 types of cancer.
Skip.
Oh, you said skip?
Yes.
Okay, what's the crux of our conversation this morning? What's the topic of our conversation this morning?
It's about cancer. What's Cancer Day?
Okay, fantastic. Name my guest that I have in the studio.
Dr. Modupe Elebute.
Fantastic. 2 questions for you. What is the full meaning of MRCC?
Skip.
Okay. Tell me, what is the name of the Deputy Governor of Lagos State?
Dr. Babatunde Hamzat.
Oh, fantastic. How many questions now?
3.
3 questions correctly. Fantastic. Your next question is this. What is the name of Kaduna State Governor?
I'm coming. Skip.
You're coming and skip. Okay. Tell me, who anchors music and moments on Nigeria Info?
Somebody fine.
Oh, fantastic. 4 questions correct for you. And your last question is this. I will ask you, no worry. Your last question is this. What is the name of the host of the Sunday morning show?
Nitali Uwaibi.
Oh, fantastic. 5 questions correctly. But stay on the line, okay? Just stay on the line. Don't go anywhere. Just stay there, all right? And we'll get your details. Well, he could stand a chance to win 10,000 naira. Others will play the same game on other shows. And the person with the highest number of correct answers get 10,000 naira at the end of the day. Many thanks to our sponsors, Creditville.
Do you need to meet up your goals for the year? Then here's the good news. Goals are easily achieved by choosing Creditville as a reliable credit assistance. Creditville is accessible and reliable at all times. With Creditville, interest rates are affordable, repayment plan is flexible, disbursement is processed within 24 hours. These and many more are the reasons why you should choose Creditville as your accessible and reliable financial partner. For more information, log on to www.creditville.ng. You can also send us an email via info@creditville.ng, and you can give us a call on 080-5510-0010. Creditville. Loans, investment, leasing.
This is Morning Crossfire on 99.3 Nigeria Info.
Alrighty, so we have to go now on the Morning Crossfire today. Well, I still have Dr. Modupe Elebute here. Doctor, we have to go. But let me ask you a question. Your center is just coming up, Master Ruth Cancer Center. What's your vision for that center?
Our vision is to provide excellent care, both from the beginning. Screening, cancer screening, which we talked about. Diagnostics, we've got our laboratory, we've got all the imaging that we need, mammogram, CT. We can also treat patients, we can do the surgery on site, we can do chemotherapy and radiotherapy. So it's to provide a one-stop shop, essentially, and not just for cancer patients, for other patients. We have other specialists in the building. But also, very quickly, just to say that we also want to collaborate with, we've heard the issues today about the public sector and collaborating to make sure we improve healthcare for Nigerians generally.
We have to go now. Doctor, thank you so much for coming around. I'm Sheriff Quadry. Lagos, that's the show. Good morning to you. Bye for now.
Nigeria Info. We are more than just radio. Subscribe to our YouTube channel at Nigeria Info FM. Check us out on Facebook at Nigeria Info 99.3. Follow us on Twitter at Nigeria Info FM and on Instagram at Nigeria Info FM Lagos for live updates as it happens. 99.3 Nigeria Info. Let's talk.